This is a proposal to implement an electronic medical record system for the health system of Wicker Park in Chicago, Illinois. The basic design of the EMR system is to be one that is efficient and at a top level of cutting-edge design. The EMR will be fully integrated with all other EMR systems, similar to the Epic system. Test records will be entered into the EMR immediately. Records will be available to all physician and nursing staff. Records will be pushed to the patient portal for viewing by the patient within 24 hours. Alerts for follow-ups will be automatically created for future dates, depending on the diagnosis and procedure codes entered. Custom alerts can be created. Public policy and healthcare provision in the Chicagoland area is limited. The Chicago Department of Public Health has initiatives for health data and reporting. However, the health policy does not include initiatives for development, usage, and maintenance of the EMR systems. The City of Chicago is behind the times and still has an entirely manual process to obtain medical records, including filling out forms by hand and a 30-day waiting period. Federally, the Affordable Care Act has provided meaningful use provisions in public policy to promote the usage of EMR systems nationwide. In Wicker Park versus Chicago, there is a financial justification in the demographics for implementing an EMR system. In Wicker Park, the age majority population is 25 to 30. However, in Chicago, it is 25 to 34. The population is older in Chicago. The median age in Wicker Park is 32 and a half years old, whereas the median age in Chicago is 34 and a half years old. The median income in Wicker Park is nearly $100,000 at 93. The median income is just over half of that in the Chicagoland area, $53,000 a year. The percentage of the population with graduate degrees in Wicker Park is 25.1%, whereas the percentage of population with graduate degrees in Chicago is 17.5%. The point in this is that the population in Wicker Park is much more interested in meaningful use of electronic medical records and technological advancements in healthcare in general, meaning that the impact of an electronic medical record system implementation is much more meaningful to those in the Wicker Park area. The incentives for implementing an EMR are at 7 of the 13 pain points of the Wicker Park medical system, meaning that 54% of the pain points will be resolved with an implementation of an electronic medical record. There are many, too many to read, but patients are frustrated that they have to bring their paper records to the hospital, and they complain that the hospital runs duplicate tests because the records were not available. Departments within the hospital do not communicate properly. These problems are solved by the electronic medical record implementation. What will be implemented is that there will be alerts for hospital agencies to communicate, nursing staff, physicians. Whenever a record is available for a nurse from a physician or vice versa, the doctor will be able to view it, or the nurse will be able to view it. The results of the tests will be readily available to patients, not only through their physician or through their nursing staff, but within 24 hours on their patient portal. There's also, according to recent studies within the hospital, there's no follow-up with patients after their care, thus causing more readmissions. As aforementioned, alerts will be created based on the results of the diagnostic tests and based on the procedural codes generated during hospital stays. According to Lee, the assessment should generate an objective probability, an estimate based on evidence about the frequencies of different outcomes. For example, if 250 of 1,000 patients reported nausea after taking a medication, a good estimate of the probability of nausea would be 0.25, 250 divided by 1,000. According to objective probability, the EMR will positively impact 54% of the hospital's current complaints. The challenges of the implementation of the EMR system are that it's costly. Though it is less costly than the alternatives, the more features that are implemented, the more investment capital must be allocated. The goal of the implementation of the EMR system is to assess all of the pain points and to mitigate those pain points. And those pain points span the gamut of EMR systems capabilities. EMR systems are nearly infinitely capable, but when achieving those higher percentages of capability, the EMR systems become much more costly, to the point of integrating with the other EMR systems, which is the final stage of meaningful use according to the Affordable Care Act. Another challenge is that implementation affects the entire organization, not only in its output and its product, but also within the implementation phases. Physicians, nursing staff must be on the front lines of utilizing the EMR system, but there are also informatics and IT staff support that must be utilized to ensure that the EMR systems are implemented correctly, are used correctly, the data that flows into the interface and ends up in the output are data that is correct and also used meaningfully. Finally, the challenge that potentially could be the most impactful is that public policy in Chicago does not support the venture. Federally, it's a fortunate fact that the meaningful use tenets set forth by the Affordable Care Act support the EMR implementation. However, Chicago is one of the largest metro areas in the country, and their state and local county and city laws can oftentimes impede the implementation of something like a fully integrated EMR system. It's a large issue to surmount. References include the city data for the census, City of Chicago for obtaining medical records, and finally the Economics for Healthcare Managers by R.H. Lee.